Welcome. This is Dr. Craig from Craig Wellness and Recovery, and I had a really great request yesterday, and that was to cover guilt and shame as it pertains to recovery from the disease of addiction and alcoholism. And this is a great request because it really does boil down exactly what needs to happen in recovery, which is the development of self-love. Of course, addiction and alcoholism is a brain-based disorder, and it has to do with abnormalities in the dopaminergic processes. However, the greater half of this disease is what's left over after the drugs and alcohol are gone, and that is the mental obsession. And the mental obsession really is a self-loathing or a self-hatred about who the addict has become and how they feel about themselves. Recovery is about the development of compassion, and in order to develop compassion, we have to overcome shame and guilt. Guilt, by definition, is a feeling of remorse about something that I've done. And in and of itself is not a bad thing. Guilt in small doses can be very, very therapeutic and important, much like a compass that tells us where to go if we want to get better and where we have been and don't want to return to. And this is important. However, guilt, much like chemotherapy, if we were to develop cancer, a little bit of chemotherapy can be life-saving. However, a lot of it can kill you. And I think guilt has to be put in its place in this respect. In opposition, however, shame is a feeling of remorse about who I think I am as a person. It is, by definition, self-loathing. And this really does need to be overcome in recovery from the disease of addiction and alcoholism. Wonderful ways to overcome these feelings of shame are the 12-step facilitation groups like AA, NA, CA. These are wonderful programs in which the steps help us to develop self-love. And Father Martin is really famous for saying that if you want to help an addict and alcoholic, you have to love them until they can love themselves. And 12 Steps really does do a great job of overcoming shame. Other ways in which this can be accomplished is through one-on-one cognitive behavioral therapy or group cognitive behavioral therapy and process groups. Again, it's not a one-size-fits-all, and each individual addict alcoholic has to find their best way to overcome this feeling of mental obsession and shame. Recovery really does boil down to the development of compassion, and compassion is a deep awareness of the suffering of myself and others, coupled with a sincere desire to alleviate that suffering. And when we can do this for ourselves, we are well on our way to recovering. So, great question, comment, request. I love this topic. If you have any comments or questions yourselves, please do not hesitate to post them on social media. And again, from everyone at Craig Wellness and Recovery, we love you. There's nothing you can do about it.